Hi, I'm Dr. Jed Grissel, a head and neck surgeon. I specialize in the management and treatment of patients with diseases and disorders of the ear, nose, and throat. There are usually 3 reasons for someone to have a tracheostomy tube. First, to bypass an obstructed upper airway. Second, to clean and remove secretions from the airway. And third, to more easily and usually more safely deliver oxygen to the lungs. When a patient does have a tracheostomy tube, it's extremely important to understand why they have the trach tube, the different components of the tube, the maintenance of the tube, and most importantly, what to do when the patient faces an emergent situation.
A tracheostomy tube, or trach tube, is a curved breathing tube that is inserted into the hole made in the neck and windpipe, or trachea. The main body of the trach tube, the part that is inserted into the patient's trachea, is called the outer cannula. When present, the inner cannula is the smaller tube that fits inside the outer cannula. It can be removed for cleaning or changing, depending upon whether it is reusable or disposable. The neck flange extends from the sides of the outer cannula and has openings on each side into which trach ties are attached. The neck flange can be rigid or flexible and is able to tilt for additional comfort. A cuff may be added to the tube to seal the airway between the tracheal wall and outer cannula. This may be required for patients who require ventilation or have poor swallowing ability. The pilot balloon is used to regulate the amount of air in the cuff. Air is carried to and from the cuff by thin plastic tubing called an inflation line. The cuff can be inflated with air to fill the space in the trachea between the tracheal wall and the outer cannula. Some trach tubes come with a fenestration or window that allows for an added boost of air to the vocal cords, allowing for phonation, the production of speech, but you must have the fenestrated inner cannula as well. An obturator is used to help the patient insert the trach tube. To use, simply remove the inner cannula and insert the obturator in its place. The obturator has a blunt tip and cushions the placement of the trach tube into the trachea. Once the trach tube is in place, the obturator is removed and the inner cannula reinserted. The necessary cleaning supplies include a towel to provide a clean work area, a mirror, cotton gauze, trach tube tie, extra inner cannula, pipe cleaners, cotton-tipped applicators, suction catheter and suction tubing, sterile water, hydrogen peroxide, a small plastic tub, and gloves. The first thing you should do is wash your hands thoroughly with soap and water. Using gloves will help keep your tracheostomy clean and help prevent infection. In the plastic container, pour equal parts sterile water and hydrogen peroxide. Start by removing the inner cannula. Simply place your finger against the trach tube flange and squeeze the outer edge of the inner cannula gently, pulling it out with a downward motion. Soak the gauze in the peroxide cleaning solution. Clean the flange and the areas under and around it. Be sure to clean the skin surrounding the trach area as well, taking care to remove any secretions that may have dried. Clean the trach tube and skin around it twice a day or more often if needed. Next, use a cotton tip applicator to clean behind and around the trach tube. Be sure to avoid getting the peroxide solution inside the trach tube as this may cause irritation. Reusable cannulas must be cleaned using the peroxide solution. Use the pipe cleaner to clean the inside of the tube. Rinse the tube with the sterile water. Reinsert the clean inner cannula initially from the side, straightening it as you go. The inner cannula should click firmly into place to prevent dislodgement. It's normal to cough during the inner cannula change. First, insert the obturator into the tube. This will make the trach tube easier to insert by making it rigid. The rounded tip of the obturator will make insertion smoother. Secure one side of the new trach tie to one side of the new trach tube. Apply some water-soluble lubricant to a clean piece of gauze and lubricate the tube. Gently remove your trach tube. It's normal to cough during this process. It's important to remain calm. Insert the new trach tube. Remove the obturator while firmly holding the flange against your neck. Insert the new cannula into your trach. Secure the other side of the trach tube, ensuring that you can fit 2 fingers between the tie and your neck. And it may be beneficial to have someone help you with the trach tube exchange if possible. Supplies you will need for suctioning include a suction catheter, suction tubing, and a small cup of sterile water. Attach the suction catheter to the suction tubing. Using your mirror, gently insert the suction catheter until you make yourself cough. While covering the port that creates the suction, pull the suction catheter out slightly using a spiraling motion. Clean the catheter with sterile water. Reinsert the catheter as needed to clear the trach tube of secretions. Do not suction longer than 10 seconds per insertion. You may need to do this several times a day depending on the amount of secretions you have. Remember to clean the suction catheter between each insertion. Use a new clean catheter for each cleaning. Have a new trach tie ready prior to removing the dirty one. Unlatch one side of the old trach tie, placing the fingers of one hand on the flange to stabilize it. Attach the new trach tie to the slot in the neck flange. Remove the other side of the old trach tie. Attach the other end of the new trach tie to the other neck flange slot. You should be able to fit 2 fingers between the tie and your neck. An HME is a small filter that covers the end of the trach tube. This helps humidify your trach, thins out secretions, and protects it from foreign objects such as pet hair, dirt, and food particles. If you cough and mucus clogs the HME, simply replace it with a new one. It is important to keep your supplies organized and readily available. This will be very helpful if you have an emergency. If your trach tube should become clogged with mucus, do not panic. Start by taking out the inner cannula first. This may eliminate the problem. If that does not remove the obstruction, simply remove the trach tube and replace it with a new one. Notify your physician immediately if you have excessive bleeding from suctioning or changing out your trach tube. Call 911 if at any time you are unable to get your trach tube back in or have severe shortness of breath that is not relieved by suctioning or changing the inner cannula.